Hi, I'm Dr. Moshafar. One of the most common questions I receive from patients is about floaters. Let's talk about what they are. First, it's important to know that the inside of your eye is filled with a clear gel called the vitreous. Over time, this gel naturally becomes more liquid, which is a normal part of aging. As it does, the vitreous can gently pull away from the retina, the thin layer of tissue in the back of your eye that senses light. This process is called the posterior vitreous detachment, and it's very common. When parts of the vitreous gel clump together, they can cast small shadows on the retina, and those shadows are what we experience as floaters. These shadows are also why you can see floaters move when you move your eyes. Some people may notice brief flashes of light known as photopsias. Floaters themselves are usually harmless and simply part of this natural aging change. They often appear as small dots, cobwebs, or squiggly lines that drift through your vision, especially when looking at something bright like a blue sky, a blank page, or a white wall. The good news is that most floaters are completely harmless. They don't damage your eyes and often become less noticeable over time as your brain learns to ignore them. Still, it's important to keep up with regular eye exams to make sure nothing more serious is going on, especially if you have diabetes, are very nearsighted, or have a family history of retinal problems. You should see an eye doctor right away if you suddenly notice a lot of new floaters, bright flashes of light, eye pain, sudden vision loss, or a dark curtain moving across your vision. These could be signs of a retinal tear or detachment, which require immediate attention to protect your vision. So in short, floaters are a common age-related change in the gel inside your eye. They're usually just a harmless visual nuisance, but any sudden changes are a good reason to get checked right away. Regular eye exams are the best way to keep your eyes healthy and your vision protected. Thanks for listening. If you have any questions or concerns about your vision, feel free to reach out to us at Hoops Vision in Draper, Utah at 801-568-0200.